Good morning, guys. This is Brij Karmur, one of your co-hosts from the SABCR Brain and Health Talks. Unfortunately, I'm not with my co-host Zarbaf Mayo today, but we do have a guest who is here to talk to us about mindfulness meditation and its effects in our life and the benefits of it. And her name is Vicky Looby. I'll let her introduce herself.
Hi guys, my name is Vicky Looby. Thanks for having me on the show this morning. I am one of the members of the Take 5 initiative, and I'm really happy to be here this morning. So thanks for having me.
So, what do you mean exactly when you say Take 5 initiative? So, do you want to just elaborate for a bit on what exactly Take 5 is and what your goals are?
Yeah, sure. So basically, Take 5 was founded through a different initiative that was founded through another initiative. So I'll start from the beginning, maybe. The first initiative that started was from Dr. Patrick Dean, and he wrote this letter called Forward with Integrity. And the long and short of that letter that he wrote to the community was that he wanted to see individuals in their undergraduate career not just sitting there writing assignments and doing exams, but actually making an impact on the community and actually doing something more with their education.
And sorry to interrupt, Dr. Patrick Dean as in our president. Right?
Yes, absolutely,
Okay.
the president of the university.
Of the university.
Yes. So Dr. Patrick Dean wrote this letter, and he put it out there, and he was actually told nobody was going to read this letter. However, my professor, Dr. Khan, in my clinical neuroscience class, she did read the letter. And she ended up creating an initiative and was inspired from that, an initiative called Mac Engaged. And so she was trying to take information that individuals were learning in their clinical neuroscience class and have them create some sort of project to make an impact on the community, which the community itself was left up to the individual to decide what kind of an impact they want to make.
Right.
So, I'm sitting there in this clinical neuroscience class not knowing anybody, and I recognized someone from a first-year class, and he knew a couple other people, and Take 5 kind of, the individuals came together, and we were all very interested in mental health and meditation and the effects that meditation has on somebody's mental health. So, we came together and we wanted to work on, mental health and meditation and where could it go from there. And one day when I'm sitting in a different lecture and my mind's wandering and I'm not paying attention at all, and I'm now thinking about this project on meditation and how I want people to pay attention to themselves and not have their mind wander. I was like, what do I want people to do? And I want people to take 5. And that's kind of where the name came from itself.
Okay.
So yeah. So now Take 5 is, doing this initiative about mindfulness meditation, and we're trying to get people right now. One of our many projects is to get people to be involved in a 30-day challenge. And so to take 5 minutes a day, every day for their next 30 days for their overall mental health. And that's
perfect.
One of our initiatives. Yeah.
Yeah, that's really great. Vicky, so it's basically, you guys are taking, as I understand, something outside of your classroom to make an impact in the community, as Dr. Dean, he wrote in his letter.
Exactly.
So how about, you mentioned that, your focus of this project is on mindfulness meditation. So do you want to just in general, quickly say, what mindfulness meditation is all about and how it impacts practitioners in their lives?
Absolutely. So basically what mindfulness itself is all about is learning to pay attention to whatever is happening to you at any given moment in time. And you kind of do so in a non-judgmental, non-critical way by training your mental skills and kind of observing the events around you, your thoughts, your emotions, and you're trying not to react to them. So basically, when you're trying to meditate, a thought might pop into your head that, I have to go grocery shopping, or, I'm feeling really bad about my day today. you're acknowledging those thoughts, but you're not reacting to them.
Oh, okay.
And then those thoughts, kind of pass, and you continue.
Right. That's interesting. Well, that was a very good summary. What about, in a neuroscience perspective, what do you think, what are the things going on in the brain that are related to mindfulness meditations, or, whatever happens when you're mindful, like when you're meditating? So do you want to talk a little bit about what happens inside your brain when you're doing this?
Sure. The reason that mindfulness meditation has started to become more popular over the last decade is because a lot of studies have started to show that there's correlations in brain activity when people are meditating. A lot of these studies that have been done show the changes in the brain after like an 8-week meditation stress reduction program has been done.
Mm-hmm.
So some of these areas are like the anterior cingulate cortex. That area is responsible for executive attention, regulating your emotions, and when you're meditating, it will actually, over this 8-week period, increase in size and thickness.
Really?
Yeah. Another area of the brain that can get affected is the insula. That's kind of, again, surrounding your emotional awareness. And over the 8 weeks, it has shown as well an increase in size. Now, obviously you can't just look at your brain and say, hey, it's increasing. These are, MRIs are done with these individuals before they start the 8-week process of meditating, and then again after. And that's how they're seeing the size difference happen. Another area of the brain that has been shown, something that I have trouble with sometimes, is in the posterior cingulate cortex. That's responsible for like your mind wandering, which a lot of us have, sitting in lecture or something like that.
Definitely.
And this, when you meditate over a long period of time, it decreases your mind wandering. So those are just some of the areas that get affected. So the amygdala is another area of the brain that is affected, and it's responsible for like your negative events and emotions. It's also about the perception of threats and situations. And so when you meditate, gray matter decreases and it becomes inactive during meditation.
Oh, really? So I think from the amygdala, is it saying that when you do practice mindfulness, all your response to threat or your perception of threat is decreased?
Absolutely, yes.
Oh, wow, that's interesting.
And the prefrontal cortex is another area that they've found correlation with. Prefrontal cortex is responsible for your decision making, your planning, abstract thinking. And all of those areas, when you start meditating, they get activated, and again, that area has been shown to increase in size, and that's reflected on MRIs.
Oh, really? So I guess with this, we can infer that, you're after, going through, let's say, an 8-week program, as you said, people or individuals practicing may have, clear thinking afterwards, or, they would have less trouble trying to, as it says, it's abstract thinking, so with planning ahead of your time. So something like time management, I guess, something of that sort would be directly affected by, by this data of the prefrontal cortex.
Exactly. Basically, some of the benefits of meditation is that, these areas increase in size, and what they do is they increase your focus, increase your attention, and increase your awareness to your surroundings, your attention. They help you focus on like one activity at a time. A lot of us feel that multitasking is something that's very important. However, I think we've kind of lost the ability to just focus on one singular thing. So the meditation helps with that. Yeah.
And I can definitely attest to the fact that, mind wandering and trying to get things done while you're sitting in class trying to listen, it is, sometimes we do get carried away in our thoughts and in our tasks.
Exactly.
Very important tasks that like Facebook.
Yes. No. Exactly. Everyone needs to Facebook.
Yeah.
But the big thing that they're finding when people do these 8-week meditation programs is that they end up writing tests that show that they're able to now focus on one task at a time and pay full attention to that one task.
Mm-hmm. And I think even going farther than that, if you're a practitioner and if you keep going with your initiative, I think after a while you get so good that you can do everything in such a short amount of time.
Mm-hmm.
For example, I was talking to a friend earlier and talking about how before when you weren't practicing mindfulness, you would take something, like say 5 hours to actually grasp a concept you learn in lecture. But now, after doing something of that sort, you'd only take 1 hour, let's say.
Exactly.
Right? And I think that would help because it frees up. Even let's say if you wanted to multitask in 1 hour, you could still do so because everything would just be very focused, and you would get that task done well before you thought you would, right?
Exactly. And they're relating mindfulness to a lot of different areas. One of them, reducing anxiety, reducing stress,
Mm-hmm.
that kind of thing. And so mindfulness is starting to be used in hospitals with patients and yeah, with everyone.
Yeah, that's good. Do you want to talk in general about the benefits in terms of, let's say, on a scale of student life or work life or life at home? Like, so what is it like to see the benefits of mindfulness in our daily lives?
Absolutely. So basically, with benefits of mindfulness, let's say at home, for example, you could be you have your relationships, whether it be with your husband, with your kids. When you meditate and kind of try and get that attention and that awareness around you, you start becoming more aware of the individuals around you.
Mm-hmm.
So it affects your tolerance level of people. You have better control of your emotions.
Mm-hmm.
It enhances your relationships, increases your ability to maintain relationships. And you kind of have more self-insight and you recognize your own qualities.
Right.
I'm a very loud, outspoken person. So, when I meditated, I'm more aware of that. So, having a conversation with my husband, for example, I'm aware that I can, my point, I like to make my point and that's it. So maybe I should back off a little bit
Mm-hmm. Mm-hmm.
and hear his side of the story.
Right.
It helps you kind of keep your cool and, try and avoid conflicts, kind of, more zen-like, I guess, if you
Yeah.
really want to say. And it kind of fosters compassion. You share your happiness with others and you're just, overall generally happy and you have a happy house. So that's, kind of at home. At school or at work, where you need to be, maybe more productive. Meditation helps increase the speed at which you process information. Like we were saying about when you're learning a new concept, what would have taken you 5 hours might now only take you an hour.
Mm-hmm.
And it also increases your quickness in performing tasks. You have more cognitive flexibility and better working memory. You become more efficient. And it builds kind of mental toughness and allows you to withstand mental pressure and greater empathy and understanding for your really annoying coworker.
Definitely. So just another last thing. So because we're talking about benefits, how do you think? Because in SABCR, what we are achieving for is to help everyone, like to help make everyone aware of brain cancer and its effects. So on a personal level, do you think mindfulness meditation could help brain cancer patients or survivors to reduce their pain or to reduce any aspect of their illness?
Absolutely. I've actually read articles and did a research project in another class about children who used breathing techniques and meditation to help reduce their stress levels before going in for like radiation or chemotherapy.
Really?
And so they would, there's a lot of invasive procedures with cancer treatments and that kind of thing. And what was happening was these patients would, kind of close their eyes and do their breathing techniques and help kind of relax themselves. And I remember there was a personal story about this, one kid, and her mother was so amazed at, how well her daughter was now handling the cancer treatments since she had started doing these breathing techniques and meditating. And, the procedures are now over before they know it. They close their eyes, and next thing you know, the procedure's done.
Right.
Because they are focused on their breathing and focused internally rather than focused on somebody sticking a needle inside you and getting all anxious.
Yeah.
So there's a huge correlation between the two, and definitely would help in this.
Yeah, that's
actually
very interesting because you can just, the way you practice mindfulness is what you can do to avoid thinking about, because mindfulness is being aware of yourself, and when you go in for a treatment, you can think about how to control that perception of pain or of anything that's happening to you while you're being treated with radiation or chemo, let's say.
Exactly.
So then, that's very interesting. I can definitely see the correlation with that.
Yeah.
All right. Thank you so much, Vicky, for coming and doing the health talk with us. Really appreciate your insight into mindfulness, and I really love the work that you guys are doing with Take 5, and I really hope that goes well and goes beyond the scope of the course.
Thank you. Really happy that you invited me to be on your show this morning. Take 5, like I said, started off as just a school project, and it's become an initiative that I'm very passionate about. And we're challenging people to do this 30-day challenge. So if you feel like you need to take 5, maybe find us on Facebook and take part in our 30-day challenge. Everyone deserves 5 minutes.
Definitely.
So.
I for sure will be doing that.
Excellent.
So all the very best with your project and with everything else. So thank you again for coming on the show.
No problem. Thank you.
And we'll see you guys next week with another Health and Break Talk by SABCR. Bye.